If your very first steps in the morning feel like stepping on a tack near your heel, there's a good chance that you're dealing with plantar fasciitis. Here's what is actually going on inside your foot. Stick with us because the fix is probably simpler than anything. Run your hand along the bottom of your foot and you're tracing the plantar fascia, a thick band of tissue that connects your heel bone to your toes and supports your arch like a built-in shock absorber. Plantar fasciitis is when the band gets overloaded and irritated, usually right where it attaches to the heel. Now let's be clear with the big myth right now. A heel spur is not the villain here. Plenty of people have heel spurs and zero pain, but fascia is the real story. So why does it hang around for weeks or even months? Think of it as a simple math problem between the load and recovery. Every day you walk, stand, move, you're loading that fascia. Overnight, it tightens up, which is exactly why those first morning steps hurt the most. Then you warm up, feel better, and push through the day, which reloads the tissue and never fully recovered. Add tight calves, worn out shoes, hard floors, or sudden jump in activity, and the cycle just keeps feeding itself. The pain is not random. It is a tissue asking for a better balance between work and rest. When you come see us in the Fort Lauderdale and Plantation office, we do not just glance at your foot and hand you a stretch. We dig into the whole story. When did it start? Where exactly does it hurt? What does it do those first steps feel like? And what does your day actually demand from you? Then we get hands-on. We check the tender spot at your heel, test your calf and ankle flexibility, look at your arch and how you walk, and screen the whole chin from your foot up to your hip. We're also watching the red flags, the things that are not classic plantar fasciitis. Sudden pain after an injury, numbness or tingling, swelling, fever, or pain that wakes you up at night, all deserve a closer look. And part of our job is catching those early. Once we know what we're working with, we build a plan in 4 phases. Phase 1, we calm things down with smarter load, supporting footwear, gentle stretching, and hands-on soft tissue work. Phase 2, we restore motion, freeing up the calf and ankle so your fascia stops getting yanked with every step. Phase 3, this is the one people skip. We rebuild capacity by strengthening the foot and calf so the tissue can actually handle real life again. And phase 4, we get you back to the good stuff, your walks, your workouts, your full work day on your feet, with a simple routine to keep the pain from sneaking back. Notice that resting and hoping is not one of the phases. Rest alone tends to feel great until the moment you stand back up. Now, what about all the high-tech tools you have seen online? For stubborn cases that have not budged with first line of care, we might bring in the Shockwave therapy, which uses sound waves to nudge healing in tissue that has been struggling for months. You may also use laser therapy to support comfort and recovery. Here's the honest part. These are helpers, not magic buttons. The research is clearest when they sit on top of the basics, the stretching, the strengthening, the footwear. So we reach for them when your specific case calls for it, not as a shortcut around the work that actually rebuilds your foot. Picture a teacher on her feet all day. 4 months into sharp morning heel pain, she rated a 7 out of 10. Tight calves, a little overpronation, and a foot that has lost its strength. We start with relief and footwear changes, layered in hands-on therapy and stretching, then built her foot back up with progressive exercises. By week 2, mornings were manageable. By week 8, she was back to her evening walks with barely any twinge and a quick daily routine to keep it that way. If your heels have been running your mornings, let us help you take care of them. Book a complimentary consultation at our Fort Lauderdale or Plantation office and grab our free plantar fasciitis recovery guide using the link below to start your day. Your first pain-free morning may be closer than you think. At Carpe Diem Chiropractic, we help you seize the day